Hello everyone, this is Jeffrey Munson at the Clearfield Medical Group with Dr. Bill Clearfield.
You know, technically it is Clearfield Medical Clinic. We actually transcribed it wrong when we did our official paper. So we kind of messed up.
All right, so it's Clinic Group, whatever.
Yeah.
So when you look it up, it's Clearfield Medical Group. And today we're going to talk about what?
We're gonna delve a little bit more into hormones and brain injuries.
Okay, hormones and brain
injuries.
Okay.
Yeah. So we're gonna take you back to the year 1985.
Okay.
Right? It was a very good year,
Yes.
right?
Okay.
It was, I think it was the year in between Ghostbusters 1 and Ghostbusters 2.
Okay.
Right?
All right.
So in 1985, there was a French scientist named Jean Ballou,
All right.
and he discovered that the brain has its own system of making certain hormones,
Okay.
independent of the rest of the body.
Okay.
Okay? And so, you're usually, when we think about hormones, you think about the thyroid, the thyroid's here, that's where it comes from.
Mm-hmm.
And, for testosterone, it's down there.
Okay.
It comes from down there, and in girls, it's for, ovaries.
Okay.
Right? But what he found out was that the brain has its own system. It's sort of like a fine-tuning system.
Mm.
So, we're going to talk a little bit about testosterone and brain injuries today.
Okay.
And, what is the reason that we're seeing, if you have to look, that we have testosterone issues, or for females, estrogen and progesterone issues with brain injuries.
Okay.
And the answer is twofold. One, where the brain originates them, is in two types of glands that are deep in the brain. One is the hypothalamus, and the other one's called the pituitary.
Okay.
Now these are located, if you take a string from your bottom of your chin to the top of your head,
Mm-hmm.
draw a line through there, and then from ear to ear, where they meet in the center, that's where these two glands are.
Okay.
So if you think about any type of disruption of the head injury,
sure.
these glands are going to get all kind of jumbled up.
Sure.
And they're very delicate.
Mm-hmm.
They have very thin blood supply,
Mm-hmm.
and very delicate nerve interventions.
Okay.
And these are the main hormones that they produce, the precursors that tells the brain to tell the rest of the body to make the hormones for our body.
Okay.
Okay. So that's one reason. And the second reason is our French friend discovered that independent of that, the brain has all of the all of the chemicals and mechanisms to make the hormones on their own.
All right.
And so you might want to think of it as, let's say in the world of testosterone, that our body is the big picture, but the brain fine tunes it.
Okay.
And so now we've lost that fine tuning,
All right.
and so we're getting transmissions all over the place,
Okay.
and that's why we get these hormonal disruptions.
So
The consequence of that is that we look at, there's four main hormones
Mm-hmm.
that get disrupted when we have traumatic brain injuries: growth hormone, testosterone, estrogen, and progesterone. Those are the four main ones.
Okay.
There are two minor ones. One's called DHEA, and another one is called pregnenolone.
Okay.
Okay, and so we need to look at all of those. So today we're going to talk a little bit about testosterone.
Okay.
Okay, so testosterone deals with strength, energy, a sense of well-being. It's for it helps with muscle tone,
Mm-hmm.
urinary retention, vaginal dryness for women, erectile dysfunction for men,
Oh. Right.
and it's what makes a guy a guy.
Right.
Okay, but it also has certain functions in the brain, and it's kind of like the excitatory function of the brain. So,
Okay.
so someone who has a brain injury with a testosterone issue attached to it will be fatigued and depressed.
So can I ask a question about that? So is the testosterone come because of the brain injury, or did they have a low testosterone in the first place, and then they got a brain injury?
We wouldn't know that unless we had some measurements or had some issues before it. But if they had it before the brain injury, it's only going to make it worse.
Okay.
Okay. And so, and again, this isn't in everybody. Like I said, it's in previous video. It occurs in about 56% of our patients on average within 1 year.
Okay.
And
That had brain trauma.
had brain trauma.
Okay.
Right? And without any type of intervention, at at least 36% of patients after 2 years will have the same, will show it, exhibit these hormonal disruptions.
Can we explain to them what brain trauma would be classified as? So what would be a brain trauma? Obviously, a concussion would be a brain trauma.
Yeah,
but-
it could be a bump on the head, all the way to you were in an accident and you've been unconscious for 3 months.
Oh, okay.
And there's a scale.
So someone going skiing and
Yeah,
could
yeah.
hit even they still were
ski into a tree
Sure,
or something.
Yeah, there you go. So okay, so it could be anything, but
Yeah.
but they could have
And the severity of the injury, it doesn't matter. Okay.
Oh, gotcha.
Okay.
Okay.
And for skiers especially, it's they go through the moguls
Mhm.
and they're jumping around
Oh,
like
I never
that,
thought
and
of
it
that.
bounces the brain in and out.
I never thought.
So
of
I
that.
never had it head
Guys who
injury.
go off-roading or even
Oh, yeah.
dirt
Yeah.
biking and
Yeah.
stuff like that.
Mhm.
Oh wow, I never thought of that.
Mhm.
Because you're like, I wear a helmet. Yeah, but your brain's being bounced
Yeah.
around.
Exactly.
Okay.
Yeah.
Okay, that's important.
Yeah.
Cool.
Mhm.
All right.
So, if we look at testosterone,
Mhm.
we talked about the symptoms before. So, what some of the keys, and one of the keys that we found is that you don't want to use too much. We naturally make
Mhm.
a 25-year-old naturally makes anywhere from a male makes from 5 to 12 milligrams of testosterone a day.
Okay.
Okay, so and a female about 1 to 2.8 milligrams of testosterone a day.
Okay.
Okay, so if we calculate that weekly and just kind of round it off, it's anywhere from 35 to 40 milligrams of testosterone to 77. We'll round it off to 80 milligrams.
Okay.
So we
That's
go
what
to
we produce.
we produce naturally in a week,
Okay.
in 1 week.
All right.
So we've gone to we see especially older gentlemen they go to the testosterone clinics or they go to and we give them 200 milligrams in a week.
Wait,
That's what they get.
Is that what they're supposed to get?
No, well, no, that's what they get.
Oh, so
and
these
you will feel
other clinics
pretty.
are doing that.
Yeah.
Oh, geez.
And then they have to give you an estrogen blocker,
Oh, wow.
right? Because testosterone breaks down into estrogen,
Okay.
and that's where you get the man
man
boobs.
boobs. Wow.
Right? And you start whining like a teenager, among other things.
Okay.
Right? And
Wow.
the guys with high estrogen levels those are the guys that have heart issues, high cholesterol, higher heart rates, higher blood pressures. They have problems from that.
Right.
The estrogen blockers will lower your estrogen.
So.
But-
go ahead.
Estrogen increases the blood flow to the brain. So if we block your estrogen with the
no.
estrogen blockers,
Uh-huh.
guess what's going to happen? You're going to end up with low intracranial, low blood pressure in the brain.
Okay.
You're going to end up with memory issues. You're going to end up with
Really?
behavioral issues, and so we're actually inducing it. So what we found is that we want to use a lower dose. You don't want to use those high doses.
I do want to clarify when you say that's what we're doing. It's not what you're doing.
No, that's not what we're doing.
Okay,
But that's what we did.
That's okay.
Right?
So
And
just
that's
doctors in general
kind
looking at
of
testosterone and all that.
kind of what's out there. Yeah.
Okay, that's what's
So
out there.
so we're actually using lower doses. We really want to stay away from those estrogen blockers.
Okay.
So we can get blood levels. The witching hour is way too high. Is about 40. Okay. The sweet spot is about 15 to 25. Okay. The estrogen blockers, they can take you all the way down to nothing.
Really?
Okay. So estrogen increases blood flow to the brain by about 224% within about 3 to 6 months.
Wow.
Okay. So you need some of that, especially the guys.
Okay.
And so if we block that, we've created another problem.
Right.
So we use lower doses. We use 60 to 80 milligrams, which is physiologic for a 25-year-old. That's what you make. And then we're going to use the precursors that turn into testosterone, and that will be more physiologic and will decrease the conversion to estrogen, but give you just enough so that you get enough blood flow to the brain.
Okay.
So we're going to use DHEA and pregnenolone, which are those precursors.
Okay.
So pregnenolone is called the mother hormone
Mm-hmm.
because it actually turns into every other one, and that's actually has been shown to improve memory
Okay.
and cognitive function.
Okay.
Okay, So that's what we do. So we're going to use lower doses.
Okay.
We're going to use the precursors. We're going to stay away from the estrogen blockers.
All right.
And so, especially with folks with head injuries.
Okay, so to kind of recap it, so how would someone know if they should get a consultation with you and talk about that? I mean, what do they think?
If you're getting nowhere, you know, you've had some sort of head injury and for years and years and years, you have behavioral issues, depression, fatigue. Those are the two main symptoms that we see. 55 to 77% of the head injury patients end up with some sort of depression, which is a lot of times not very amenable to antidepressants. Within a year of the head injury, 100% of the patients have fatigue, sometimes an overwhelming fatigue.
Okay.
Okay, so those two are the kind of.
So if they went to their doctor, you know, 6 months or a year or whatever ago, and what would the doctor have given them? Or would they have class?
Well, you know, if you're
depressed or all this stuff.
Yeah, if you're depressed, you know, we'll give you some antidepressants. You know, you use your.
Not you then, right?
Well, yeah. And,
So
we may get that on the back end, but we're going to look at this on the front end.
Okay, but
and quite frankly, most of the folks who come to me, they've been to many places.
Right, so they've been to other doctors.
Yeah, they've been to a lot of places. They've gotten nowhere.
Yeah.
So.
Because you're an alternative medicine.
No, I'm not alternative. I'm doing the real deal.
Well, I mean, in classification, you're not just a doctor who's going to here's some pills.
No,
not at all. I mean, so that is an alternative because you're not just doling out. Here's my script pad.
Mm-hmm. Well, you remember from way back when we did our Hashimoto's thyroiditis.
Yeah,
you remember the one who called me a shaman?
So, anyways, the idea of being people coming to you because nothing else has helped them.
Correct.
Is the biggest thing, and I know two other people that come here, and that's what they told me because they had problems, and you're the only first one that's helped them. So, because you approach it differently, you actually approach it to find out what their symptoms and their problem is instead of here's some drugs.
Right.
So, anyways, cool. All right. So, if anyone you know has had any brain traumas, concussions, whatnot. Or just in this sense of depression, anxiety, what else?
Mood swings.
Mood swings, anything like that. Talk with them and have them contact Dr. Bill and see what's going on and get it fixed. So, all right, everybody. So, everyone, thank you very much for watching this. This is really important because a lot of people don't understand how long something can happen after a trauma is.
17 years later, we document it.
Okay.
So,
but typically it's about a year.
A year to 3 years
Okay.
is the usual.
Okay. All right. So everyone, have a great day, and please be a good human.